crisis is real out here. I say that to say because I'm addressing my mental health issues just as well as my substance abuse issue. So now I have some type of balance in my life. And I truly want to thank Hillcrest. I mean, truly. The SUD program has really been helping me. It goes out to the facilitators, the counselors, but it's one person I have to give shout out to, and that's Miss Jamila, because she referred me to come here, and I've been on this journey ever since. Born and raised in Southeast Washington, I'm a product of Ward 8. Bury Farms, MLK, anything come across 11th Street Bridge, that's me. That's me. So it's an honor to be right here. I might not be where I want to be, but I thank God I wasn't where I was either. Today I'm not homeless. I have a job today. I'm a productive member of society. And I'm paying bills. I can go on and on and on, but I want to take this opportunity. It's a pleasure and it's an honor to introduce our mayor of the city, Mayor Bowser.
Let's give Garrett a big round of applause. It's good to be able to pay bills, isn't it? And when he said he was paying his bills, I quickly said, and taxes. Welcome to Hillcrest, everybody. Let's also give Juanita Price a big round of applause. We know the fantastic work of Hillcrest. I also want to acknowledge our wonderful team at the Department of Behavioral Health, led very ably by Dr. Barbara Bazron. Give Dr. Bazron and team a big round of applause. We are also joined by members of the Mayor's Community Affairs Office, led by Director Jackie Reyes. Give Jackie Reyes a big round of applause. Our Community Affairs Office, of course, is in all 8 wards, in all D.C. constituencies, talking about how all government services can help D.C. residents. We are here today to talk about mental health. It is Mental Health Awareness Week, but we need to make it Mental Health Awareness Day every single day. We know for sure that this pandemic has upended a lot of people's lives and a lot of our services. And we want to say, and Dr. Bazron says this best, it's okay to ask for help. If you're feeling depressed, you're feeling anxious, you may not even be able to put a word to how you're feeling, but you're not feeling like yourself. And we want you to reach out and ask for help, ask to talk to somebody. So we have a hotline for you to call at 1-888-793-4357 or 888-7-WE-HELP. And you can be connected to trusted, confidential assistance to make sure that you get the right services. When I say this pandemic has upended our lives, a lot of people, they lost contact with their work, their friends, their churches, their doctors, their services. People, and we know, are living with a lot of stress and trauma on the normal, and those stresses have been exacerbated. Millions of people in our country on a daily basis are confronting these stressors. So now more than ever, we want to open up the conversation around mental health, and we want to reduce the stigma that prevents many people from accessing care. To that end, I've charged my team with making it easier for D.C. residents of all ages and backgrounds to get the support they need. Over the last several years, we have invested over $30 million in school-based behavioral health services to ensure that every child in every public school has access to a mental health clinician. This is one reason why we were so dogged about getting schools reopened safely, so that our children can have access to trusted adults, mental health clinicians that know how to help. But parents, we can't help kids and your family if you don't ask for help. So make sure, I want to just reiterate this. In every school, there's somebody who could link your child to the mental health supports that they need. Don't assume that the teacher is going to figure out how to make the connection or knows that the connection needs to be made. You call your principal, call your teacher and say, Mayor Bowser said there's somebody in this school, in this building who can help us. And I want to talk to that person today. And so that is how we can ensure that all of the investments that we make actually turn into help for people who need help. Will you do that? Will you make sure you tell a family that you see struggling? They may be struggling with their child. Will you do something for me? Will you say, Mayor Bowser said there's somebody at your school that can help? Did you call the school? Did you talk to the principal? Did you talk to the teacher? Did you ask to be connected to a professional that will help your family confidentially? Will you do that with a family that you know? Will you? Okay, because that is how we can make sure that everything that we're investing turns into help. So Dr. Bazran is going to share some details. I've shared with you the main number about how you can call to get access to confidential assistance. You can post, you can print these little cards out, you can post, and you can share so that DC residents know that we're here to help. So with that, I want to turn to our fearless leader at the Department of Behavioral Health, Dr. Barbara Bazran.
Thank you so much, Mayor Bowser. Good morning. I am really privileged to serve as a director of the Department of Behavioral Health, and I really want to thank every single one of you for coming out here today. This is really, really important. I also want to acknowledge Dr. Sonora Simpson, who is the chair of the Department of Behavioral Health's Planning Council, and thank Mrs. Price also once again for partnering with us on this event. We also have the privilege of having Mr. Christopher Charles from the Latin American Youth Center here with us also today. May is a time to raise awareness of those living with mental health or behavioral health issues and to help reduce the stigma around mental illness that might prevent someone from getting the help they need. Stigma is a major barrier. We gotta move mental health out of the shadows. Mental Health Awareness Month provides a timely reminder that mental health is essential and that those living with mental health issues are deserving of care, understanding, compassion, a pathway to hope, healing, recovery, and fulfillment. After all, that is what we all want and need now more than ever for ourselves, for our loved ones, and for our communities, and for, in fact, the entire world during this time. The Department of Behavioral Health plays the lead role in ensuring that residents have access to the full continuum of mental health services and supports, and to help residents find the resources that are available in their community. DBH certified community-based providers exist all across the city, and like the one here at Hillcrest, Children and Family Centers create a unique partnership to provide the mental health services that our residents need. If you need services, please reach out. Please reach out. Good mental health is just as important as good physical health. They actually go hand in hand. It has never been more imperative than now to recognize that mental health is an essential component of one's overall health and well-being, and that mental illnesses are common and they are treatable. While it may be that some of us are more vulnerable than others, everyone faces challenges in life that can impact their mental well-being. After all, just a few years ago, as the mayor said earlier, none of us had any idea that our world was really going to change and that we would be affected by COVID-19. And that worry, isolation, loneliness, depression, and anxiety would be the reality shared by literally every single one of us. None of us is immune. Since the beginning of the pandemic, I am so grateful that Mayor Bowser has invested over $40.8 million to provide essential supports for children and families during this pandemic. We know that residents need varying levels of mental and emotional support, and that the mental health hotline gives people the support they need when they need it with just a telephone call at no cost. We're here to listen and respond to mental health challenges before they reach a crisis. Early intervention and early identification is critical. As the mayor said, call 1-888-793-4357 or 1-888-7-WE-HELP anytime to speak to a trained mental health specialist. Support is available 24 hours a day, 7 days a week, so you can call at any time. If you're feeling depressed, anxious, or just not kind of yourself, you can talk to someone now to help sort out your feelings and get you the support that you need. The collective experience of living with emotional and psychological impact brought on by COVID helped to cultivate more awareness of mental health issues. However, many people have unfortunately struggled with mental health and mental health issues for their entire lives. According to the National Institutes of Mental Health, mental illness are commonplace, with nearly 1 in 5 adults in America living with a serious mental illness. 1/2 of all chronic mental illness begins by the age of 14, with 3/4 by the age of 24. Some have co-occurring mental health and addiction disorders that make life even more difficult. And I think you heard from our wonderful speaker, Mr. Jones, about his experience with co-occurring disorders. We've all made countless sacrifices during the pandemic, whether physical, emotional, social, or financial. It has presented challenges that have tested our strength and resilience and affected the mental health of all of us. The mental health hotline supports the mental well-being of our families, our communities, as we work together to build a safer, healthier, and more equitable District of Columbia. While raising the awareness of mental illness, we also want every resident to remember mental health services are accessible, and you will see people within the crowd passing out some cards that give you the details of how you can call. If you remember nothing after this, please remember to call 1-888-793-7-WE-HELP. 1-888-7-WE-HELP. That's important. You're not alone. And as I mentioned earlier, a trained mental health specialist is available. Before I leave you today, I want to personally express my appreciation for our dedicated mental health specialists and the community-based organizations that provide vitally important treatment, care, and support for individuals living with mental illness or struggling with active addiction or other social stressors, or just being stressed out. We could not be more grateful for their response, adaptation, innovation, and resilience that our partners have demonstrated by providing critical mental health care to our city's most vulnerable citizens during this time. So thank you, and once again, please note, we are here to help. We're only a phone call away. Thank you.
Well, thank you, Barbara Bazron. And now we'll take a few questions if there are any press questions, and then I'll take any community questions. Press questions? Yes, Mark.
Mayor Bowser, or maybe it's for the director, do you have any data on suicides during the pandemic? If we've been seeing an increase and what that trend is? And then I have another follow-up.
I thank you for that question, because if you look at what's happening in the news nationally, you do see instances where there is data reported on increases in suicide. We have really not seen the increase in suicide rates here within the district. The district historically has had higher rates of attempts, but not completions.
And then is this a program that is going to be in place in perpetuity now, this hotline? I know it was created
Absolutely.
during the pandemic, right? But is it something that's going to be continued on?
Yes, absolutely. We have always had a hotline available within the district. The mental health hotline was specifically created, as you mentioned, during the pandemic. But this is a part of our system of care, and it will go on indefinitely. The other thing to note is that we are also working along with other states across the nation as we bring up 988, which will be the single three number a call that will allow you to get a whole variety of crisis services and other mental health services within the next year or two. So that number will be in place. Those services will be in place indefinitely and in perpetuity.
Do you know when the 988 will be up and running?
Next year, in July.
In July of next year,
Right.
of 2023.
Right.
I appreciate that. And my last question on this, is this hotline open to non-DC residents? If somebody were to call from outside of DC, what happens then?
If somebody calls, first of all, I do want to share with you that our hotline is a part of a national suicide prevention line and is certified by the American Society of Suicidology. And so if a call comes in, and sometimes we do get calls from people who are not residents of the district, we then will link them appropriately to the resource within their jurisdiction.
Dr. Basran, another question. Could you tell us basically the impact that COVID has had, particularly on mental health distress in the city?
Mm-hmm. I think that there are a lot of individuals within the city. I mean, all of us have felt some kind of stress, but it doesn't reach the diagnostic level of mental illness. And so we do need that kind of support. And one of the things that I want to share is that if you're feeling those stressors, that you should call the Access Helpline. And many of us are feeling that. We're finding that is something that many residents within the district have experienced. I get calls personally. Not only from all residents and from others regarding the stressors that they're experiencing because of isolation, because of changes in their routine, because of not being able to participate in normal activities, and this is particularly among our young people who didn't get to go to the prom, didn't get to go to other activities that they were looking forward to. And so our school-based behavioral health program has become even more important than it always has in addressing those kinds of stressors.
My question is whether there are any numbers that indicate exactly, an increase in, suicide, or an increase in a particular area that you would think is connected directly to the COVID?
We do have, call volume numbers, and I can certainly share that with you, as a follow-up. Okay.
Yes.
And Mayor Bowser, a couple of off-topic questions. About the infant formula shortage. I know that Department of Health and WIC is working with WIC providers. I'm wondering, does the district have a reserve at Serve DC or another agency of infant formula and are you considering, if so, providing that, making that available, or any other efforts that you're doing to try to help DC parents get the formula?
That's a good question, Mark. I would have to, we do maintain some emergency supplies through Homeland Security. I will check. If we do have some supplies, it won't be a lot. It would be to help us get through some short-term emergency. But let us follow up with that. We recognize that this is a shortage that was created by the shutdown of one of these factories. We recognize that President Biden and the administration and FDA are working to help get that supply going again. But it does highlight, evidently, we have 3 manufacturers of baby formula for the whole United States of America. And one being tripped up is hurting a lot of families. Talking about stress, we know that parents of infants, having an infant produces in a family enough anxiety about making sure you're doing everything possible for your baby and not being able to find food. I can only imagine is creating a lot of stressors for families. So I haven't particularly, in Homeland Security is our agency who keeps a close eye on our food supply, and I will get a report about what we're hearing from stores for district parents in particular. But we'll stay on it. We encourage the federal government to do all that it can to get the supply going again. But we also, we discourage hoarding, because sometimes the scarcity of products makes people buy more than they need right now, which can exacerbate the problem.
Can I ask about the homicide rate? We are now above what we were at this time last year in the number of homicides. Just, I mean, you get this question a lot, I realize that, but what is your word to citizens who are concerned about this growing number of murders in D.C.?
People are concerned about safety. Nobody more concerned than we are in the government, and making sure that we're doing everything humanly possible to drive the numbers down. And we will drive it down, but we need everybody working together, and that includes the community. So we, as you know, are making sure that we have the police deployments that we need, and we're going to continue to do that. Chief Conti has been very focused on working with our partners and working with our federal partners to talk specifically in areas where there is a high level of shooting to get access to guns. But I have to ask the community for help, too. We have put out a reward number. We have paid a number of rewards for information leading to our confiscation of an illegal weapon. So we need people to keep working with us and doing exactly that. So we're going to keep pushing, Mark. We had a long discussion with the CJCC last night about violence interruption efforts, where we have introduced millions of dollars to make sure that we have people who are out in the community and talking to people before they make a bad decision using a gun. So Sam asked earlier about what do we see as the impacts of this pandemic and upending, and you heard Dr. Bajron say the stress and anxiety that people are experiencing may not rise to the level of a mental health diagnosis, but it also has led people to make some really bad decisions with guns that take lives and ruin their own. So we know that those stressors, anxieties, anger, short fuses, call it what you want, it is out there, and we see it. We see it in the type of disputes that are being handled with guns on our streets. So this is what I say to DC residents. I've had in leadership, I've seen other violent spikes. We have thrown every single resource at those spikes, including the $40 million that we're talking about here for mental health services in schools, in the community, on hotlines, and we will drive down this violent activity. Any other questions?
Community questions?
Yep. Community question?
Yeah.
Okay.
I'm Lennon English. I'm a resident. I live right next door, as a matter of fact.
Okay.
I want to know, what are you going to do about the effects of police brutality and police violence against African Americans in the city? Both the mental health of the victims, who are the African Americans, but also the mental health of the administration, police officers that are participating in this brutality?
Well, if there are police officers that you want to call to our attention, we don't tolerate. Are you listening? Okay, we don't tolerate police that don't follow the rules. And so what I need you to do is make us aware of any police that aren't following the rules. What we want are police that work hand in hand with the community, that are able to build trust in the community, and work every day to keep communities safe.
I'll give you the name of the officer right now.
Okay.
Officer Nickerson is
Okay.
known.
Nickerson?
Officer Nickerson
Okay.
from the 7th precinct.
Got it.
He and 8 other officers took the hinges off of this building right here and came into my home without a warrant and without any probable cause and beat me, tased me in my living room naked, fresh out of the shower, over and over again. On January 26th last year, I came to your office about it. Y'all didn't do anything to those officers. Y'all haven't done anything to help my mental health at all.
Okay,
So I want to
there
know,
was a police.
Officer Nickerson and 8 other
Okay,
officers
let me just
are
ask you a question. Let me just ask you a question. There was a complaint made already, I assume. Okay, so then we can follow up on it. Okay. Any other community questions? Yes.
How you doing, Mayor Bowser?
Good.
My name's William Jackson. I'm a bus operator for the DC Circulator. I'm also an advocate for ATU 689 on behalf of the operators. As you know, we recently went on strike, a strike that lasted just 3 days. However, what I want to know is, in terms of mental health, what is your administration going to do going forward with helping transit employees deal with stressful situations, including being assaulted on the vehicles, also dealing with contract disputes, dealing with these private companies such as RATP Dev, which I told the Washington Post just last week is the same as moderately paid indentured servitude. That's what it feels like working for them. So what is your administration going to do going forward to make your transit workers under DDOT for the streetcar and the circulator feel secure in knowing that we have a future here in DC going forward?
Well, I'm pleased that you got a 3-year deal that all of the workers supported, I understand. And so that's good. What we don't want to see is our circulator buses stop running. Because when that happens, that means residents on all 8 wards, most of the wards of the city, don't have access to that service. I'm proud of the work that we have been able to do to invest in the DC Circulator so that it serves the National Mall, but it also serves all 8 wards of the city. So just like we do with all of our workers, now DC Circulator workers are not DC or DDOT employees. But we want to make sure that everybody is paid fairly. This is the thing that I know. A lot of people during this pandemic showed up in person every day. We didn't have the luxury of being able or the privilege of being able to work at home. A lot of people did. Bus drivers weren't one of them. Even, the mayor's communications team, they weren't one of them either. People who are answering calls for mental health services, a lot of them had to be in person too. So we want to continue to keep that up. But I had a chance to talk to your ATU president. I had a chance to talk to local president and national president. And I think you came to a deal, didn't you? Okay. So that's where I stand. All right. Thank you, everybody. Yep. Okay. It's okay. What's your question, dear? What's your question? Oh, you want a picture? All right, let's do it. All right, everybody. Oh, one last question. Okay. Sorry. You look beautiful. Okay. Thank you. Tony? Okay. Oh, Tony Duggar? That's your cousin? Okay, I got it.
Anthony Bowser.
And Anthony. Okay. Good to see you. All right, last question.
Hi, my name's Eric Scharf. I'm a resident of Ward 1, active in the Depression and Bipolar Support Alliance here in D.C. We're a peer-based organization.
Okay.
Really excited that Robert could talk today. I was so excited to hear his story. It was really as much a question for Dr. Bowser.
Okay.
As we work towards the rollout of 988, we're really excited about 988. It's going to be an incredible new resource for the city. But how do we better incorporate peers in this whole process, both in responding to calls and being out in the workforce, and our peer support specialist profession in the city?
Okay.
A key place to incorporate, folks who are lived experience with mental health and substance abuse disorders, but it's really a system that's not been well used in the city. So I'd really like to hear what kind of things we could do to
Let me ask
that.
Dr. Reyes-Ron to speak specifically.
Okay. Thank you for that question. First of all, I am a real advocate for peer services, as you know, and have been throughout my career. We have peers working in all sorts of parts of the system. Everything from within our core service agencies like Hillcrest, and some of them are here. As a matter of fact, Mr. Jones is a peer, as well as in hospitals, as well as with our community response team. And we also have many members of our mental health team here, many of whom are peers. So that's one thing. The second thing is that we also are working to increase the availability of our certification program so that we can grow the number of peers that are available within our community. People with lived experience have a great track record of being able to engage individuals, to walk with them over time and get them into the care they need. So thank you for that. This is a very important resource.
Thank you. Thank you, everybody. Thank you.